Breaking news tonight, the devastating toll of the coronavirus. 2,000 Americans killed in one day. More people have died now in the U.S. than any other country. The new field hospitals being built. And this.
The number of hospitalizations appears to have hit an apex.
New signs of hope in New York. The crackdowns across the country. Major outdoor parks now closed. New mandatory rules for face masks. This man dragged off a bus for not wearing them. Back to business. The growing debate over when to reopen the country. Apple and Google joining forces to help. Early arrival. Those stimulus checks from the government hitting many bank accounts today. Some as high as $4,700. The success by the Bay. Only a dozen people killed by coronavirus in San Francisco. What can other cities learn from them?
This is NBC Nightly News with Jose Diaz-Balart.
Good evening. We begin with breaking news on the coronavirus. For the first time in history, all 50 states are now under major disaster declarations. This after the U.S. reached a new grim milestone today. More than 20,000 Americans dead by the virus. Now the highest death toll in the world. We're watching new growing hotspots across the country, but there are also some signs of hope in the worst hit areas, that the rate of spread may be slowing. We're covering this from every angle tonight and begin with Kathy Park in New York City.
Tonight, signs that New York's stay-at-home order may be working.
The number of hospitalizations appears to have hit an apex.
New infections and hospitalizations are slowing. The crisis appears to be under control for now in the suburbs, but the number of deaths keeps climbing, now more than 8,600.
It is stabilizing at an horrific rate. These are just incredible numbers, depicting incredible loss and pain.
The death toll is now far below original projections, but the governor warns that it's still too soon to make the call on reopening the state. But New York City Mayor Bill de Blasio did make a decision to close all public schools for the rest of the school year, impacting more than 1 million students, now adjusting to remote learning.
And we can never get in a situation where we end up jumping too soon and regretting it later.
Governor Cuomo says not so fast.
You can't make a decision just within New York City without coordinating that decision with the whole metropolitan region, because it all works together.
State officials are expanding testing, opening additional sites in minority communities hit harder by the virus. New York City releasing data that shows blacks and Latinos have seen twice the amount of deaths from this outbreak. And more field hospitals are going up too, like this one by New York Presbyterian and Columbia University, bracing for a potential surge of patients.
It's hard to predict. We're preparing for that eventuality. Whether that comes to pass or not, one can only speculate.
On the front lines, fatigue and fear are setting in. Christine Haynes is an ER physician at Lenox Hill in Manhattan.
Although admissions seem to be down and discharges are outweighing admissions, we're still seeing sick patients. So it's not over yet. It's not over yet.
But healthcare workers are encouraged to keep going. This Long Island surgical nurse praising volunteers, now part of the team.
They deserve kudos for coming to Level 1 Trauma Center. That's a hot spot, and I'm so grateful for them. And so is everyone else. Thank you.
And Kathy joins us from New York Presbyterian Columbia University's field hospital that's going up right now. Kathy, when will they start receiving patients?
Well, Jose, the space officially opens up on Tuesday. It has the capacity to treat up to 288 patients with mild COVID symptoms. Former military doctors, nurses, as well as medics are also here to support the medical staff. Jose?
Kathy Park in New York, thank you very much. As the surge slows in some areas, the new hotspots are a major cause for concern, and local officials are taking drastic new measures to keep cases down. Eric McLaughlin reports.
Tonight, for the first time in U.S. history, a major disaster declared for all 50 states. This as concern grows over emerging hotspots.
COVID-19 is becoming like a sniper in the viral war, silently taking out healthcare workers.
COVID-19 infections on the rise in states such as Rhode Island, North Carolina, and Pennsylvania. Saturday, the state announcing more than 1,600 new cases and at least 70 new deaths. As cases rise in Philadelphia, a shocking encounter caught on video. Even though there's no law mandating passengers must wear masks, police drag a man off a bus for not having one. Following the incident, local transport authority says it will no longer enforce the policy encouraging riders to wear masks. This as states double down on social distancing.
Now is no time to relax the social distancing.
Some introducing new and tougher restrictions. Friday evening, Los Angeles extended its safer-at-home order until May 15th, the longest of any city, also closing all parks and masks mandatory for essential businesses. This week in hard-hit Michigan, residents can no longer visit friends or relatives. Those who have more than one home banned from traveling between them.
All public and private gatherings of any size are prohibited.
Restrictions leading to progress. On the front lines outside Detroit, signs the stay-at-home strategy is working.
We're seeing a plateau of COVID cases based on the volume that's coming to us through our front doors. And that is both a bit of a sigh of relief, but it's also this anticipatory pause and hoping that the trend continues.
But the progress comes at a high price. Florida, the line for this Miami food bank around the block, as more lives are lost. The state of Colorado's youngest victim, 21-year-old Cody Lister, died this week fighting the virus.
Cody was young and he was healthy. He is proof positive that this virus does not discriminate against age.
Amidst the tragedy, there's also hope. Washington State, once the country's outbreak epicenter, now a working example of how to flatten the curve. This week, an Army field hospital dismantled and returned to the Department of Defense without treating a single patient. Still in Seattle, concern. It's unclear how this will end.
Right now, we don't have a clear picture of how this pandemic is going to kind of trail off. And that's the part that worries me, is what we do to make sure that things don't get worse.
Aaron joins us now. Aaron, you're talking to doctors on the front lines. What are they most concerned about?
Well, Jose, doctors in Seattle tell me they're most concerned about complacency as the situation improves and that curve flattens. They're worried that people are going to let their guard down, and therefore there'll be more cases and potentially more lives lost. Jose?
Aaron McLaughlin in Los Angeles. Thank you. President Trump is planning to launch another coronavirus task force next week to help tackle the question so many are asking. When will America be back to business as usual again? Morgan Chesky reports now on the tech giants joining the effort.
Tonight, a nationwide debate. The president naming a task force to get America back open, pandemic or not.
This is beyond economic. This is really, I call it the opening our country task force. So don't let anyone get any false ideas that when we decide at a proper time when we're going to be relaxing some of the restrictions, there's no doubt you're going to see cases. I would be so surprised if we did not see cases. The question is how you respond to them.
The calls to reopen coming as unemployment spikes.
Reopening is both a public health question and an economic question. Can't ask the people of this state or this country to choose between lives lost and dollars gained.
Google and Apple want to help solve that by joining forces to create an app for contact tracing, which finds anyone who could have crossed paths with a positive case. The plan uses high tech to contact trace, pass by someone with the app, and the phones anonymously record you've had close contact. If that person gets COVID-19, the system notifies anyone they've been close to, so they could self-quarantine or get tested. In Europe, encouraging signs. Germany launching their own tracing program using similar technology. And Denmark, one of the first countries to shut down, now says they'll gradually reopen up daycares and schools starting next week. A glimpse at a post-pandemic future may look like the place where it originated. In Wuhan, China, a cautious optimism. As millions return to work, the world watches and waits.
I think one of the biggest concerns that we have about reopening too early is that people will get a little bit complacent about our social distancing. And if we fall back into old habits right away, I'm afraid that we're going to see a second wave of illness.
Morgan, this new app from Google and Apple is already raising concerns over privacy. How are these companies responding?
Jose, at its core, it is a form of surveillance, but both companies stress that this app is voluntary. That means even if you contract COVID-19, it's still up to you to input that information into your phone. And they also point to the fact that these companies are only using Bluetooth data and are not actively tracking your location. Jose?
Morgan Chesky in Dallas, thank you very much. As Christians across the world prepare to celebrate Easter tomorrow, there's growing concern that some groups will gather for worship, further spreading the virus. NBC's Sam Brock now on how some local governments plan to stop them.
Tonight, the call for empty churches and cathedrals is conflicting with a different reality.
The angel of the Lord, the Spirit of God has spoken to me and says, don't be afraid.
Some congregations, like this one in Orlando, convening for Palm Sunday a week ago, with the pastor touching parishioners to heal them.
In the name of Jesus.
And planning to reopen their doors tomorrow. That's true of the Life Tabernacle Church in Baton Rouge as well, which is expecting 2,000 or more people. Stark warnings have come from some governors, like Kentucky's Andy Beshear.
I hope people will see in this time with what is out there that we are living our faith by being willing to change the way that we're worshiping this weekend.
But he's warning of recording license plates of churchgoers and forcing them to quarantine, drawing a rebuke from Texas Senator Ted Cruz. Hashtag Stop Persecuting Faith, adding in a separate tweet, I live in Texas, where we protect public safety, but aren't authoritarian zealots. In Kansas, the state Supreme Court reviewing the governor's ban on church gatherings of more than 10, which was overturned by the legislature. The state speaker says there's more to the story than that. What was the reason for the reversal?
I definitely don't want people to go to church, and I don't want them to go to jail if they do.
The countrywide divide coming with high stakes. Of the 15 states with the most vulnerable populations to coronavirus, 11 of them have some kind of religious exemption. Florida's governor giving this guidance.
The state of Florida is not going to, through government coercion, close a church, synagogue, or place of worship.
But in South Florida, all 109 parishes under the Archdiocese of Miami, 1.3 million Catholics, will only have the option to stream services online.
That's kind of tempting God. It's being foolish. And, the gospel tells us to be courageous, but not to be foolish.
The boundaries of faith being tested as Christians prepare for the holiest day of their calendar.
Sam, for churches in states that have special exemptions, are there any circumstances they could get in legal trouble?
Yeah, Jose, there's a couple situations that are likely to trigger legal action. One of them would be churches not honoring the 6 feet of space between parishioners, and the other one exceeding the cap on the number of people allowed inside at one time. Jose?
Sam Brock in Miami, thank you. Still ahead tonight, those coronavirus relief checks are starting to land in some accounts today. When will yours arrive? And throughout the program tonight, we're spotlighting the moments that unite us, like these cheers of joy from and for a coronavirus patient released from a New York City hospital yesterday after days on a ventilator. We're back now with a surprise for many Americans. Those stimulus checks from the government went out early. Some received them in their bank accounts today. Senior business correspondent Stephanie Rule joins us now. Stephanie, good seeing you. Why have some people received them but not others?
Jose, they are going first to people who filed their taxes previously using direct deposit. That way it goes straight to your bank account. Now, if you haven't received it yet, don't worry. They are not going out all at once, but they should be by the end of next week. And if you didn't do direct deposit, the government is sending old-fashioned checks, but that could take a few weeks.
And Steph, who qualifies?
All right. Well, almost 80% of Americans do. You qualify for $1,200 if you make less than $75,000 a year, and you get an additional $500 for any kids under the age of 17. One new development for people who don't file their taxes because your gross income was under $12,200. Well, the IRS has launched a new tool for you to set up direct deposit, and that is available at irs.gov. And in the coming days, they're going to be launching an online tool so you can check the status of your payment.
And Stephanie, with no firm date to reopen the economy, is $1,200 going to be enough?
Listen, Jose, it's not. You and I every day hear stories of people who are struggling in our own towns. Everything is shut down. Now, the president has said he is open to a second round of stimulus checks, but he can't clear that. It has to get negotiated through Congress, and it could be necessary because we don't know when this thing's going to end.
Stephanie Rule, thank you very much. Coming up, ahead of the curve, how one major U.S. city managed to keep coronavirus cases and deaths so low. And this moment that unites us, New York's bravest honoring our healthcare heroes outside one city hospital. As coronavirus cases climb across the country, there's one major American city that seems to be winning the fight, keeping case counts and deaths surprisingly low. Jacob Ward reports from San Francisco on what they are doing right.
This COVID unit in a 600-bed San Francisco hospital has only 20 patients. For medical staff who plan for a tidal wave of suffering here, it's disorienting.
Many of us here on the front line feel a sense of guilt, and seeing the suffering from colleagues who are across the country in Elmhurst, New York City, in New Orleans, in Michigan.
In fact, things are going so well that UCSF plans to send a portion of its medical staff to New York.
It's got to feel different if you were in China or you were in Italy or now in New York. It definitely does not feel that way here.
So the objective here was to flatten the curve so that we could take the pressure off of hospitals. It sounds like we have definitely done that here in the Bay Area.
No question about it.
Why such an extreme difference? Well, lower urban density, wealth, and luck certainly played a role, but acting while the caseload was small seems to have made a big difference. San Francisco, Berkeley, and 5 Bay Area counties issued stay-at-home orders on March 16th, 8 days before the first death in San Francisco.
You might say a week, could that make a difference? But this is the thing about exponential growth. A week can be a lifetime when it comes to this thing.
Plus, in early March, some of the Bay Area's biggest employers, Facebook, Google, Apple, told their people to stay home.
Dr. Wachter also says San Francisco's low smoking and obesity rates may have kept people from becoming very ill. The state of California was the first to order shelter in place because of that quick action. According to a widely used model, projected deaths in the state of California will top 1,600 by August. But in New York, a state with roughly half California's population, the model projects a much higher death toll, more than 13,000. When will these streets be filled with people again?
You have to have the public health capacity to do the testing and do the contact tracing. You have to have the hospital capacity to take care of patients. And probably the most important, the number of cases has to be going down to almost nothing and staying down.
Health officials don't know when that will happen. So for now,
prepare for the worst, expect it, but hope and pray that we don't ever have to deploy those resources.
Jacob Ward, NBC News, San Francisco.
And that's NBC Nightly News for this Saturday. Join us tomorrow evening as we take a look at promising new antibody tests and how they could help the country reopen. I'm Jose Diaz-Balart reporting. Thank you for the privilege of your time. Stay safe.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.